The slides, a couple started recording. Welcome back. Welcome everyone. We'll be uploading the slides momentarily to the chat box, and we'll do it again because we have breakouts, and so then they go away. Again, we love interaction. So while we do have breakout sessions, please feel free to raise your hand or write in the chat box if you have comments or things you want to share. And the slides and the recording will be posted to the web if you want to go back and refer to it or have new staff or, have staff turnover. We have, excuse me, a little congested today. Today's session is 2 hours. We think we'll get through everything, but if not, we have a lot of slides for reference, and we'll pick up any important content at session 3, which we'll do in January. But we also have a lot of resources for you guys at the end. So one thing we learned at last session, that was kind of a new thing for us, was that a lot of you don't have working cameras or working microphones, and then we're doing all these breakouts, and it's hard to have a conversation if your mic isn't working. And Shannon quickly came up with a solution last time, which was great, that I forgot all about, that Zoom gives you a phone call an option. So there's a phone number there, there's a meeting ID and a passcode. So if you are on a computer that doesn't have a mic, we have a few minutes before we do the breakout, the first breakout, but you can use that telephone option so you can participate in the conversations. We'll also put it in the chat, or it's probably already there, because I'm going to move on from the slides. Okay. So okay, I see 47 people here, so I can't see everybody, that's for sure. No matter how small I make my screen. But we don't have time to go around and say hi to everybody, but we are hoping, and one of our goals is, of course, always for you to make new connections through the breakout sessions. Your agency and your role and title, or title if you'd like, your location, could be your could be your town, and your favorite ice cream flavor. We like to kind of have a little clear the deck, and especially since it is actually Monday afternoon and not Monday morning, thinking about ice cream and maybe having some ice cream later. What's your favorite ice cream flavor or your favorite alternative treat if you don't like ice cream?
There's one. Pralines and cream. Yum. Ooh, pistachio cookie dough. There we go. Coffee. Moose tracks.
Vanilla with peanut butter, mocha chip. Okay. Mm, interesting. Salad plate strawberry, moose tracks, chocolate chip cookie cupcakes,
Jen, I thought
coffee
your
cream,
favorite ice cream was
dash.
Connecticut vanilla, and I thought, huh, what an interesting name for an ice cream.
You know what? That was my very bad typing. I was meant to write New York City, in case I didn't mention that. But yeah, not Connecticut. It's Haagen-Dazs Belgian chocolate chip, or something like that. It's a lot of chocolate. It's a very redundant. I'm a chocolate person. All right, I see a bunch of smiling faces. There's some Rocky Roads. Great, and we have a lot of people from all around the state. You can see that. Oh, we can really just diverse here, Connecticut.
Ooh,
A lot
toasted
of places
almond.
there's a lot of mint chocolate chip. I'll just say that's like the national winner. Lactia. Okay, if you can't have cream. I know a lot of people have that. All right. Well, so that's a little bit silly, but that's a little bit to make you take a breath, think about something nice, clear the deck, as we say, and maybe give you an idea for what you're going to have this afternoon. Although it's not a great ice cream day, although I know people who believe every day is a good ice cream day. So indulge if that's going to be good for you. So we've done our welcome. We're happy to see you. We're happy you're taking time. We're going to talk about today going really deeper into the work of outreach, the actual work that you guys do of helping people move to the next place in their life, achieve their goals, move on, hopefully get into a safe place they can stay in. And doing that by coordinating with partners, connecting people with income, and then also really talk about the support through the move-in process. So hopefully everybody's going to get to housing. And we know from
Mm.
talking with you that there's a shortage and it's hard to get housing. And some people are just taking their time. They're not quite ready to move along in the process, or, we need to have more patience with them. There's a lot of reasons why it takes time, but certainly the support through the move-in is so important because it's a really challenging time for people. Even though it's a great opportunity to be in housing, it brings up for people how they lost housing before. And we know that, right? We know that it brings up the prior situation and what happened, and people's fears about it happening again come up. So it's a challenge. But luckily, the way the outreach program is designed is really for you guys to provide support through that first 3 months of transition. And we'll talk about that support, and we'll talk about like using the warm handoff, because the person who finds a person housing is really important, right? You're a really important person in that person's life, and maybe a savior. And so transferring the engagement to the next worker or whoever's going to be supporting the person is really important. And then, as we said, we'll have a bunch of additional resources for you, and exciting things coming up that I think are great for outreach in Connecticut. So, Connecticut was an early adopter of Housing First, and you guys doing outreach, especially street outreach, have been focused on helping people get into housing forever. So this is really, I don't know why there's red lines on here. Are those, I
I
don't
don't
know,
know. I was
somehow
thinking the same thing.
wonder if I drew on those by accident. Sorry, not sure what they are, but anyway, they're meaningless, just little red lines. But that really is that people are ready for housing when they don't have a home, right? And that we provide services post housing to help people maintain, follow their lease, be a good tenant, and move on in their lives, and hopefully not return to homelessness, right? So it's an evidence-based practice. Um, you guys are really good at it in Connecticut. The challenge is really supply, and also, getting everything in place that people need, because a lot of times they don't have documents, and that takes a while to set that up, as well as income and other connections. But it's really about moving people in and then providing that support afterwards. Of course, because it's winter now, it's cold, right? People are outside and they need basic needs met. And so, housing is first, but also, helping people with their basic needs for safety and comfort is also first, really, with outreach. So, but we're bringing up housing, and we talked about this last time, right from the first engagement. We're always, bringing that up gently. Sometimes it's, again, some people people are in different places about housing and ability to talk about it. So we want to be respectful of where people are, but our role is really to support that movement. So when we look at, what makes really good housing first practice, it is assertive engagement. So a person may say, you know what, I'm not ready. I don't want to go inside. I'm good here. I have my buddies. We have good tents. We're safe. We take care of each other. We have a community. I don't want to leave them. Maybe if they're living, with a few other folks outside. But we're continuing to do assertive engagement, not aggressive, but assertive. We're continuing to bring up housing. We're continuing to say we know they can do it, build confidence, right? Because that's what scares people off sometimes, right? Is that they're not going to be successful in a new place, that they have it figured out now, and the devil you know is better than the devil you don't, right? And they are making it work. But we're going to continue to use assertive engagement. We keep bringing it up. And if the person doesn't want to talk, okay, but we bring it up again. But we're building motivation, and we're really thinking about folks having the confidence to manage housing and feeling like they can do it, the competence, and that it's important to them, that it's going to get them something more than what they have now, right? If I'm living with a group of people and we are taking care of each other and we have a good system figured out, how do I know that this is going to be a better situation for me, right? So we want to make sure that the importance and how it connects to people wanting long term is out there, is always out there. So we're doing a good assessment. We're learning housing history. We talked a little bit about this. Andrew's going to go deeper on it today. We're doing a good housing history and a homelessness history, right? So we want to know both stories. Has the person had their own lease? Have they ever, managed their own home? Have they always lived with other people? What caused the episode of homelessness? Because most likely and unfortunately, what caused the episode before is what's going to cause the episode in the future. So, in helping people prevent another episode, we want to know what caused it before. Did they lose their job? Was it their car breaking down and then they stopped the rent payment and they still have that clunky car and that's going to happen again? Well, what are we going to do? Maybe it's helping them get another car, but we want to have a good sense of what's happened before, what they are good at, if they have managed their own lease. I know we're seeing increasing numbers of people in the homeless population at both ends, at the young end and at the older end, older adults who are homeless for the first time and also have not really had to manage a lease in a long time. Maybe they lost their home. We're seeing some people, and I just heard about that recently. Somebody in Connecticut ultimately lost their home and they had been a homeowner. So becoming a renter is a whole new thing. So we're also looking at harm reduction, risk reduction, helping people reduce the barriers to housing, reduce barriers to stability, but harm reduction that's recovery oriented. And when we use those words, and we use those because we know many of you use that language in your programs. And when we talk about it, we're talking about helping people meet their goals and helping people assume roles in their life that are important to them. So getting what they want and being who they want, right? Being a formerly homeless person is not a role, right? So we're helping people become a tenant, become an artist, become a peer support worker, or whatever it is, but help them achieve their goal and help them reduce the barriers that get in the way. We're doing a lot of linking, and Andrew's going to pick up on this a lot, to resources, income and benefits, um, treatment resources, health services. I mean, a lot of times that's how people will engage, is maybe through healthcare provider. I know many of you work very closely with healthcare providers, and that's an initial way that people will engage for services. Also connecting people up to a faith community, that's really important. Libraries, sports, arts, recreation. Some of these things, people are not going to really be ready to take on while they're still living outside. Some people may start planning for moving inside. Some people may return to friends and family, right? And that may be the best resolution for their homelessness at this point because of available resources and because of work that we might be able to do to mediate conflict and bring more resources into the home through that person if that's a good solution for them. So we're going to look at what the resources are that can really support people no matter what the outcome is going to be. And then I think the last and most important thing is, even though there's standards for outreach, even though there's best practices, even though there's guidelines, even though there's forms, even though there's templates, this is still an individualized service. It is based on a relationship. It's based on engagement. It's based on what you guys are excellent at, most excellent, I should say, which is connecting to people and engaging with them in a relationship where they believe you believe in them and you believe that things can get better for them. And that's how people can help move themselves forward, is through the energy that you bring and helping them with their goals and with the things that are important to them. So I'm sure, excuse me one second. I know many of you have gone to motivational interviewing trainings, have or certified. I think we have some people here, or maybe even certified in motivational interviewing. And that's a practice that's also evidence-based that really has taught us a lot about helping people change. I started as a substance use counselor back in the days when they thought you got some people to stop using substances by making them feel awful about themselves.
Hmm.
To the point where they were crying, frankly. And guess what? The science doesn't show that. Anybody who's tried to make a change knows that the day when you're trying to make a change and your knees get knocked out from underneath you is the day that you think, well, forget that salad goal. I'm having a burger. Because we need to feel strong to make changes, right? So important concepts is, and when we think about change for a person who's living outside, it's really the change is moving into housing, right? And that's the change that they're facing. And that's, again, big change, big transition. So we want to help people feel a sense of hope. We want to convey hope to people that we think it's possible, that we recognize their strengths, that there'll be support to make it work, we want to know what the meaning of housing is for them. How is that? If the person doesn't see getting housing is important to achieving something else they want, maybe reunification with family, maybe being able to get a job, maybe being able to have some privacy, your own bathroom for some people. Um, but what is it that housing brings for that person and that makes it important to get? And we want to understand that through our process of really learning about people. And then we also want to build confidence. And that's um, really important. A lot of folks have lost a lot of confidence, especially when they're living outside. You guys know that for sure. But people are managing, and it is not easy, as you know, to manage to live outside and keep yourself alive and eat and stay warm enough and all that jazz. And so people do have strengths and helping people to see and build their confidence based on what they've been able to do before. And that's what's so important is knowing people so we can help them be themselves, but move along in that journey, in a journey that they can do. All right. So now, if you haven't connected, it's in and you don't have a mic, you want to dial that number on your phone because we're going to do breakout discussions and have a chance to talk with each other. Introduce yourselves because you'll be probably with people you don't know. Hopefully, it's a random assignment. Talk about strategies that you've used to help build clients' confidence for motivation to move towards housing.
Yes, I found.
Talk about or these are prompts. These are not, answer A, B, and C. Brainstorm ways to make progress with a person who has given up hope or said they have no goals about housing and build motivation. So any of the things that have helped you enable to move people forward. So if you have any troubles, you can always come back to this main room and we will help you. Sometimes you get kicked out of a room. Sorry, 1 second. Just to create these things. Okay. So there we are. We'll give you about 12 minutes, I say. I think we have time for that, about 12 minutes, and then we'll come back and share some of the strategies that you found helpful. Pause the recording, Shannon.
Thanks.
Okay. Sorry. Welcome back, everybody. Looked like we can just see little microphones and cameras going on when you're in your sessions, but it looked like there were some lively discussions. Does anybody want to share anything that came up in their group? I mean, I think we do want to share best practices as much as we can. But anybody hear anything or share anything that they want to share with the larger group on ways to build folks' confidence or motivation, or people who have become hopeless while they're homeless, helping them have some hope? You can raise your hand or put in the chat
Mhm.
or unmute. Aisha, did you want to say something? You unmuted?
I did. So one thing
Great.
that I believe James had said, he was saying how would we approach, someone that's in a homeless area, but hasn't formally came up, said that they were homeless, but they speak a different language. And you don't want to just go up to them and just assume that they're homeless because they're in that area and they might just have dirty shoes or something like that. So I thought that that was like a good question.
Good. Thank you for sharing that. Anyone else? Any creative strategies?
I'll go. I think that, well, in our group, I think we kind of just all had similar strategies to go about it. I feel like It's a difficult situation when you're just meeting someone and they're in a vulnerable state. I feel like some things that we kind of do here is just to like, if we identify a client, give them your card, start small, obviously, just say who you are, and then, ask them to come in and see if, if they're interested in services, like come in for an intake and just kind of see where they are, just meet them where they're at. Not everyone's going to open up right away. What we do here, we offer services, and just kind of just see if they're interested in anything, see if they need, I don't know, hand warmers, sleeping bag, anything that we can provide just to kind of make them feel a little bit more comfortable and just them knowing that, we're there for them in any way possible. And then if they do want to schedule another appointment with you and they're interested, then that'll open doors for other things. And then you can kind of like start going off with goals and seeing, what works best for them. But I feel like that's the approach most of us kind of I guess agreed with, just meeting them where they're at. They're not going to open up right away. So
Yeah. Thanks for sharing that. That's great. And, the gentleness that you told it with, I think is also so important, right? Is really being respectful of where people are at and taking it small, but providing some relief. Rabia, I see your hand raised. Did I say your name right?
Nah, but that's okay.
Can you say
In
it
our group,
correctly?
Robe,
Robe? Okay.
in our group, we spoke about like active listening, with fall in line of just kind of paying attention to their needs. We also spoke about leaning on like the process, um, and what they'd be going through in the process. With just with a lot of their needs to help them get out of homeless.
Yeah. Responding to people's needs. Thank you. Thank you for sharing that. Shelley, did you want to say something?
Oh, yeah. We had a situation where we were helping close down an encampment and getting the 7 individuals housed. Well, there was one couple that wanted nothing to do with us, wouldn't talk to us for a long time. Had people like watching to make sure when we were coming, they would let them know, so they would hide out. So finally, we were able to get, talk to them, being very consistent, like on a daily basis, going there every day. They'd start talking a little bit more. Finally moved them out of the encampment. But what had happened was there were a bunch of people there that day when the encampment was closing down. This person took off. I was able to call him and tell him that I'm going to send everybody away because he was uncomfortable with everybody there, which we did. And, he came back, we housed him, and he's doing very well. And he's finally gained his trust. It was a long process, though.
That's great. Thanks for sharing that. And, it's a good example of what is it that's going to make that person feel comfortable. And everybody really talked about that and safe to be able to move forward. Thanks, Shelley, for sharing.
You're welcome.
These are great. Thank you for sharing them. I hope you had good conversations in your groups for others that we didn't hear from, or made new friends that you'll have more conversations with in the future.
Suzanne,
Andrea, you want to say, yeah, go ahead.
yeah, is that Shelley, it's a really good example. And as Rabe said, active listening is really important as well as active observation. So you sort of figured out the system in the encampment, that he's had people looking out for you guys. He's got pretty good, they've got pretty good, they've got pretty good skills in that, organizational skills there, and really watching them and being able to respond to them had a lot to do with really paying attention and not just listening to what people say, but also observing what they do and really paying attention to that. And I think that's so important.
Yeah.
A great example.
And he's still that way to this day because I go there to visit like once a week.
Nice.
And one time I had one of my coworkers come, separate car, to bring some food, and that just threw him off. He said, "Look, you don't need to bring anybody. We're family now." So I knew, like, okay, we got to go back there, stay with just me showing up and leave everybody else out of the picture to keep him where he's at, because he is workable right now.
you feel safe with you, right? I mean,
Yeah,
you really feel
trust
safe
you.
with you.
Well,
And
he had some issues he was dealing and stuff like that, so I think a lot of things happened, you know. So he's
yeah,
gotta be, you know, on his watch right now.
It also shows a deep appreciation of how hard that act of trust is, how hard it is for people to really trust us, and that everything in their life tells them that this is not going to work. And the fact that they had the courage to do that is huge. And just the way that you talk about him really shows that you can really appreciate that.
Yeah.
I often marvel at people's courage to make a connection when other ones haven't worked out in their life, and in fact, they've turned out badly. And
And
that,
he's, yeah,
great.
he even said one time that, all right, I do need you know, because he's been let
Wow.
down many times.
Yeah,
He did, and he needed me for something. He goes, okay, I do need you. I'm like, so I'll work with you. I'm like, okay.
it's great. And
yeah,
also,
it's
you
great.
know, he's a brave guy.
Yeah, for
Yes,
saying that. I did, yeah, I did
Mhm.
tell him that too.
yeah. Really good stories about how, that engagement time is so precious and requires so much care and gentleness and like Andrew said, observation and really moving slowly with people, right? Which
Yeah,
this housing first and get people into housing, you want, kind of there's an urgency about that, but it is going to take time with folks,
yeah.
and that's okay, right? As long as we're kind of moving towards that goal and we're hopefully continuing the engagement, like Shelley is, by figuring out a way to engage with them, it's going to work. All right, I think I'm going to hand it over to Andrea now, who's going to talk about, the service planning process with people. Housing planning process really is what we're talking about.
So everything that we've talked about, engagement, we talked a little bit about assessment. We're going to talk more about that. Sort of the goal development, finding out what people want long term, um, identifying the things that will motivate people, all lead into developing this plan. So the plan is not sort of freestanding, right? It comes through a collection of other information and other conversations that you have with people. So one of the expectations of outreach is that they start a service plan within 30 days, right? That you complete a service plan within 30 days and then you update it every 90 days. But we're going to talk a little bit about the process. So one of the things that you want to do is there's an assessment and service planning template. Have you all seen that? Specifically for outreach. So it's shortened. It was built on Shannon just put it in the chat. So these are real examples of what we've heard from those communities of practice and put them in this.
I could
So
share it, Andrea, if you want. Do you want me to share
sure,
it?
just sure.
Yeah, for a couple seconds, right?
Yeah.
Hang on a second.
Thank you. Okay, great. So to start with stages of change.
There we go. Okay. So there's sort of instructions in the beginning, right? We talked about the 30 days, some specifics for staff for path programs. And as we go down, and remember, this plan is meant to augment the information you put in HMIS. Some of it is duplicative, but it's to make this work. So you're also going to put in the stuff in HMIS. And then you're going to ask certain questions like, what's their plan to end their homelessness? So these are all the assessment parts, right? When's the last time you had a permanent place to live? Describe that place. So it's much more narrative than you usually see on this because that's the nature of outreach. You also want to describe where they are, and we're going to talk about that piece of the assessment, right? How they're living, who they're living around, and their factors that led to homelessness. You're also going to do some stuff like, have they ever served in the U.S. military, which will make them eligible for stuff. Who provides support, emergency contact. And then as you go down, there's a strength summary, which comes from those conversations, particularly around goal setting and particularly around engagement, right? And you're going to go through this. The ones that you can identify, you're not necessarily going to fill out every part because, as people have said, these assessments unfold over time. You're going to get what you can. You don't have to do it from the form. You get it from conversations and you go back and you fill out the form. And as you go down, right? These are some of the barriers that you've observed or heard or gotten by way of a warm handoff, like from a soup kitchen and stuff, that might be barriers to the person accessing and maintaining housing, right? And this is going to give a little focus. So the whole idea is the assessment leads to the plan, right? So you're going to prioritize these things. And as you go down, right, and you're going to do this with the person, we're going to get to the plan. So we're going to talk a little bit about, in a couple of minutes, more detail about the assessment part, but I just want to direct you to the plan. So right, it's going to be done every 90 days. So you're going to talk about what their goals are from the previous plan and what are the achievements and what are the barriers. And this gives you another opportunity to reinforce the skills and the progress that people have made. Yes, this is a preferred form and this is separate from the HMIS data input. Is that right, Lauren? It's pretty clear in the
Yeah, so I think that this specific template is optional, right? Agencies
Right,
can use this
right.
template or a different template. But doing service planning and assessment is part of the standard. So you need to be doing some sort of service planning and assessment, and it's different than the data collection that you're doing in HMIS. So in addition to doing the assessment in HMIS, right, which is really just about data collection, you would be doing some sort of needs assessment and service planning.
We just want to say that this came from you all, right, through conversations. And the other part of this is that it was designed to give you something to work towards with the plan. And as Lauren said, it's optional, right? But take a look at it. And even if you have another plan that you like, and even if you have another assessment that you like, look at the areas in this plan and see if those would be helpful to add to your plan. So, as I said, the goals from the previous plan, the achievements and barriers, this gives us a chance to really reinforce people's skills, talk about progress. I said that, I know. And also talk about the barriers, but in terms of you're going to reframe what they've tried to address the barriers, and you're going to encourage them to try something else, right? So it's a reframing opportunity. It is also, there are goals in here. They're actually, it's based on their risk factors. It's based on their current assessment. And you'll notice it's only limited to 3 goals. And that's really important, right? People get overwhelmed quickly. People need to, part of critical thinking is prioritizing. So you want to help people prioritize what they want to work on. And you want people to have some success. And if they have 10 goals they're working on, they're not going to have success with those goals. So you want people to have some success and to really get a chance to look critically about their strategies, and that it's easier with only 3 goals. And also people don't become overwhelmed. And the other thing is outreach. I used to think of outreach as a series of last chances, right? And that something's got to work, right? And it's never the last chance. You can always re-engage people, but that, it's people put a lot of stake in this, particularly since you've got outreach staff tasks and participant tasks and target dates, and you're talking about what you're going to, and notice this reflects the domains of the assessment. So one of the things that we want to do is really focus on these plans and give people an opportunity to move forward. The other thing on this plan should probably be in there, and we've added it for actually the housing programs, is a resource column. And there's also something that asks what people's long-term goal or aspiration is. And those long-term goals and aspirations give them the motivation to move forward, right? If you think about it, the tasks involved in housing access and housing stabilization are not very satisfying, right? Nobody looks forward to go getting their ID, right? If they're in housing and they got to pay rent, nobody looks forward to paying rent. I mean, you all look forward to paying rent, right? In order to do that, people have got to get their eye on a bigger goal. So one of the things that we're going to do is identify those long-term goals and aspirations and connect these goals to that, right? So let's say their long-term goal or aspiration is to get a girlfriend. Okay, that's a very common one. One of our colleagues says it's money, honey, and wheels. Those are the big ones that motivate people. Everybody, not just homeless people, right? So, okay. So we're going to think about getting a girlfriend, right? So that's really what they're thinking about. Well, you know what? Getting a girlfriend or getting a boyfriend, that costs money. So maybe we can connect increasing their income to having a good time with their partner. Maybe we can connect housing. We can generally connect housing because, right? To you want that date to last beyond 8 o'clock at night when it gets dark and cold. Well, keeping housing would be a good way to do that, right? We're going to hook it up. Sorry, probably not as sarcastic there as we are in here. We're pretty sarcastic. So think about how you can connect those goals to it. Does this make sense? And we'll update this for you if you think that's the right thing. Or when you do your plan. You also want the person to participate, and you'll notice in the handbook that, or in the standards, that what they say is people have to sign, right? So within reason, but the idea is this is done together, right? And that people understand this. I also want to say that I spent a lot of years as a case manager, and I'm familiar with those deadlines coming on you like a freight train and thinking, oh God, it's time to do the plan. I got 2 hours and we're going to do it. All of the pieces have to be in place, right? Could you actually do the paperwork in 2 hours? Sure. But you've got to have conversations that lead up to it. So the plan has got to be an active part of every time you meet with people. Doesn't have to come out in paper. It could come out in paper, whatever helps people organize. But talking about the plan every time you meet with people will help you, and help them move it forward. Okay. So thanks.
I think one other thing to say, I saw the question about the
Yeah.
HMS requirements is
Yeah.
that, with the things that are required, and the forms that we fill out in HMIS doesn't really guide the conversation. And I think what was really important when the community developed this are these questions,
Yeah.
which are really more conversational and that fill out certainly HMIS data elements, but really, talking with people about what their plan is, what motivates them, and really asking these very different kind of questions from what we get in normal data. And I guess I would see them, if I was using them as a worker, as kind of conversational prompts, right?
Yeah.
To make sure I'm kind of learning these things, regardless of what I'm required to put into my data, the data in HMIS. So I think that's an important piece of this tool. Okay, so I'm going to go back to the PowerPoint, Andrea,
Yep.
right?
Thank you. Yep.
And there's a completed sample here at the link. So everything in the slides that's underlined is a link, a live link. Let us know if anything's not working, but there's a completed sample if you want to take a look at that.
And Shannon also put it in the chat. Okay. All right. So it's a process. You guys really reflected that when you talked about engagement. Sometimes it goes slower than other times. It's a conversation. It takes time for people to trust you, right? And, personally, it used to drive me crazy in housing when everybody would come in and the landlord would say, hey, how you doing? And they'd say, hi, how are you? I'm Andrea. I'm schizophrenic. I've been evicted 3 times, right? People get so used to spilling their guts that I support that people are backed off a little bit and that they want to trust you and they want to understand what your role is. And these are designed to go for that, right? So, and it also can narrow people down to get resources because you can't do everything. So resources is a really important part of this. As they experience challenges and changes and progress, the assessment will deepen, right? People are going to try strategies that they've tried in the past, even though they may not have worked. It's a valuable opportunity to try these strategies again and then critically think about it with the person about what can they tweak in that strategy that may work. That's all part of the process of learning how to move forward. You also want to listen, and you guys said this a lot, about what the person wants and what they're interested in, and that it's really important to identify what their aspirations are. Sometimes people experience you as the first person who tried to make their life better, which is a huge compliment, by the way. And they put a lot of stock in that. So they figure if they're going to get something, this is their only chance. And they may be reluctant to negotiate. We're going to talk about negotiation in terms of housing, but they may only want the perfect thing. A Section 8 voucher with a landlord that's their cousin. Okay, well, you know what? All right. But, if you listen for what they want and you can connect it, people are not going to get their most preferred housing on the first shot. They're just not, right? It's because of the barriers and stuff. But how can that work to get closer to what they want? And they should get some of the things that they want. So, Rabe, you wanted to say something? I see your hand up.
I was just going to piggyback off of something you said a little while ago. You got to be careful with the clients. A lot of the clients uh put their business out there like that as
Yeah.
a booby trap,
Yeah.
self-sabotage from the trauma they dealt with organizations being with this organization and that organization trying to achieve the same thing.
Yep.
So sometimes you have to watch where they're curating that from, because it could be a thing like, well, they're telling their truth, but with the hope of nothing coming out of it.
Yeah, and what people's expectations are, and you got to be careful and you got to have those conversations, right? And I really support the fact that people want to trust you before they give you a lot of personal data, and we want to reinforce that, right? Because believe me, when they tell their landlord all that stuff, it's like, woof, okay. So these are some assessment domains, and you saw them in the model service plan, right? These are the areas of assessment and planning that we want to look at in terms of helping people maintain housing. And this has been supported by the research. So most importantly is the housing and homeless history and the barriers to stability. And as Suzanne said, a lot of things that happened in the past are bound to repeat themselves because that's what people know. Right? So that we want to head that off. We want to get a chance to do some eviction prevention, but we need to know what their experience is, what they liked, what they didn't like, how they live in housing. So, Shelley said that she really observed how this guy interrelated with herself, the other workers, and the other people in the camp. And that's really important. And, a big part of that was he was able to use other people in the camp as his lookout, which meant he could accept some sort of help, right? So that she put all that together, and that's the sort of information and the level of information that we need. We want to know about their income and their financial literacy. How have they used income? How much do they know about it? Do they understand it? And you want to provide education and training. You want to know their employment history, their benefits history, how they manage their benefits. You want to know about their life skills. And some of that is a little hard to assess in the encampment, but what they're good at, what their skills are, and what they need work on. And related to housing, we're not going to do what they used to call in the old days ADLs, activities of daily living. Can the person bathe themselves? Well, all right, but you know what? Can the person pay a bill? Can the person pay rent? Can the person ask for help? Those are the things that we want to ask. We want to know how about their friends, their families, and other supports. And I know a lot of people think that homeless people don't have those sorts of connections, but you guys know better. They oftentimes do have those kinds of connections, but the connections often don't have resources to spare. So we want to know what those connections are, how they use those connections, and how we can help people do them. Psychiatric and substance use issues, we want to assess those, how they're affecting their trail to housing, and health and medical issues. And I just want to say something about that. Our job is not to diagnose, but to get people to the right resource, right? And we also want to offer resources, even though somebody may not be ready for those resources. But we also want to take the cues about pacing to connect to those resources from them. So we want to always offer, because you never know. They might say, I was waiting for somebody to offer me that, though that has never happened in my life as an outreach case manager, but could happen, right? Um, but we want to offer the resources, but we also want to talk to them about what the opportunities are, help people think critically about them, and them deciding the pace that they're going to connect to those resources. So we want to look at their history, what they've, what's their current status? What are their strengths? What are their barriers? What's their motivation? That's really important. And what are their goals and what are their aspirations? And we want to really reflect that and connect people to housing success, whatever that success means to them. But we basically, one of the things, the big thing about outreach is we want to connect people to a safe and secure base in the community. We want to give people the shoes to walk forward. We may not, they may not accept psychiatric treatment, but can they manage some housing without it, right? And do they know the resources? We want to plant those seeds, but we want to really focus on that base in the community. Okay. So housing history, we talked about that. You want to know the places people lived and who they lived with and what their experience was. Were they a leaseholder? Did they live in an apartment with other people? Were other people the leaseholders? Did they have jobs in that apartment? Did they have things that they took care of? What worked for them and what didn't work? And one of the most important things that I learned, and I have to admit, it took me a long time to learn it, is even, how people talk to you about housing resources that they hated? Usually there was something in there they liked. So you want to really try for both ends of that. And you want to get people into a conversation about what that was there, what that experience was like. You also want to do stuff about this homelessness history. You want to ask about the cause for the initial episode, realizing that this might have been a trauma-fraught experience for people. So take it easy, right? You're going to come back to that and come back to that. But you know what? If people don't want to answer you, they're probably protecting themselves, which, as you guys said, we want to encourage, right? I mean, do you lay out everything for everybody you meet? I don't. Um, and we want to know how long they've been homeless, how they've been homeless, if they've been in and out, what kind of homelessness is. We want to know the places that they've stayed when they're homeless, and that would include shelters and friends, as well as living outside. We want to know their routine and their role in the encampment. That's going to be really important for housing because that's often, especially that role, is what people desperately miss when they move into housing. Somebody's the boss in the encampment, they're going to look for people to boss, right? That brought them something. Roles bring people structure and purpose in their lives, and we want to think about it. If they were the guy that cooked for everybody in the encampment, or went to the food pantry and got stuff, or even the person that had a cart with little stuff like a needle and thread, or maybe a little bit of alcohol so that people could stave off the DTs. We want to know that because that's their role. Are we going to encourage them to continue that role? Specifically as they did in the encampment? No, but we're going to help them to evolve those roles so that they can get the satisfaction out of them. So we want to know what their routine is. Routines are drastically different when people are moving outside and people in housing. So we want to help fill some of the gaps. Somebody told me once who moved in from the streets into housing that he said to me, when you close the door, he said, have you ever woken up in the middle of the night and not been able to get back to sleep? And I thought, sure. And he said, what was that like for you? I said, well, it was like torture. He said, yeah, it was because you know what? Every time I close that door, I feel that way. So what does that mean? What are they used to in the encampment? What does that mean? How can we mitigate that? Turned out noise was a huge issue for him. He'd never been in a place that was so quiet as housing. So we helped him get a radio. We helped him get a TV, those sorts of things. So we want to know that stuff. And we also want to know who their supports are, right? Supports within where they're living, in the community. It might be one worker at a shelter who they always sort of come back to. We want to know who those supports are and enlist them to help the person in moving forward and be part of the plan. Okay, let's go to the next one.
Well, I just want to say something about finding people who are living outside, living with other people.
Yeah.
And I know, we've had discussions about shared housing in different forums and some trainings about it. And that's, in general, I think putting strangers together to live together is a temporary situation at best for most people. Kind of brings them back to um, other, kind of, not really intimate or living arrangements. But if you have folks who are connected to others while they're living outside, and we had success with this in New York City with people who've been homeless for a long time, is can they live together or can they live clustered near each other?
Yeah.
For a lot of people, one of the big tenancy violations they have is they move their friends in that they knew from when they were on the street, right? Let them stay on the couch. Think, why can't my friend live on the couch? Because I got a couch. So, I think thinking about that when we're talking about homeless housing planning for people, because some people are not going to get a subsidized unit. They have limited income. If two people come together, that could be a good arrangement to share housing. And if people want to live together because they have a relationship, I think reduces a lot of the issues that come up when you put strangers together, which is, not that people don't have conflicts, they still do. But I think that's an important thing to think about, and especially if people have to go into the market to find housing. Now, maybe they're going to rent a room in somebody's house, but if they want an apartment, maybe they can find something that they could actually afford if they put two people together. And I think that's a better version of shared housing than the strangers piece that might work long term, but maybe not. But I just wanted to put that out there as because I know there's an interest in that.
Yeah. So as we move towards service planning, we have to remember that the service planning is meant to guide and provide a structure for the work. I was listening to somebody and I was talking to them about redoing the plan, and he looked at me and he goes, "Why don't you just fill it out? It's so much more about you than it is about me." And I thought, okay, we got a problem here, right? He's not wrong. So how do we make it part of the structure of the work? And part of it is we bring it up every time we see people, we talk about it. We don't pull out the form and go through it point by point, but we may pull, one of the things we said we would work on, and one of the things I said I would do, and, I'm willing to do this right now. Is that something you're interested in? Is this still a priority for you? We want to go back to it. We also want to ask people always that question. And we talked about that a little bit in the last training. And basically it's you want housing so that what happens? And it helps people think it through, but you also find out what are the goals they can actually feel. And you need those goals that they can actually feel in order to help people move forward, right? The housing is not going to be perfect, right? And that, we try all these motivational interviewing techniques about, this is a problem with housing when people get to housing. This is a problem with housing. How can we do this a different way? And we try to work on the ambivalence between what they want and what they are. Maintaining housing may not be concrete enough for them, but having a girlfriend or a boyfriend visit, that might provide the motivation, right? So we want to keep striving for those things that mean something and those goals that people can feel. I tell clients that the ISP is their blueprint and map to housing and success. Yep, but it's got to directly relate to them. That's a really good point. You want to make progress manageable and identifiable. That's really important by making it into small steps. If the plan is built into two big chunks, it takes a long time to reach that success, and you don't have as many opportunity to sort of rework it and rework the strategies. You want to chunk it down, right? You want it to be manageable, and you want people to identify when they're moving forward. Because, Suzanne talked about hope, feelings of confidence, and feelings of competence, and nothing succeeds like success. And so having people, even if it's they went to Social Security to request a new card, that's a really big deal, and we want to make it a big deal, right? So we want to chunk it down as much as people need. We're also going to do ongoing assessments and update the assessments as they come up. And it doesn't have to be you do the whole plan, but if you can add it to the plan, yeah, you want to do that. You also need to realize that the plan evolves around time, over time, and as people's situation changes, people's plans will change. And finally, you want to build that sense of hope and that sense of confidence and competence. So you want to type in the chat box, what are some goals that people are working on? What are some goals that you're working on with people? Anything? Employment training programs. Okay, so employment training programs are a good thing, right? So, okay, paying off debt, right? So
Getting
let's think
sheltered.
about that. Getting sheltered. Why would people want those things? Reestablishing mental health services. Okay.
ID.
ID, Social Security. Yep. Setting appointments with American Jobs Center, document. Okay, good. So those are all increasing income, which usually people want, and if they tie it to income. So what you want to think about is what that means, stability and security. You know, it's interesting. Safety is one of the biggest goals that people have. And I always pay a lot of attention to that, getting a birth certificate, because that's necessary to get a lot of things. So you want to not just focus on, you want to chunk it down, but you also want to have a discussion about what that will get them, right? Because people do things to get something, and that having a social security card in your hand may not directly relate to them, that they might get benefits, they might get, right? It might be a step towards housing and you want to chunk it down that way. Yep. Okay. Enrollment for veterans. Yeah, there's a lot of resources there. So you want to talk about that, right? Okay.
Well, and I see so much money, and I think money is something people will
Money's
engage
huge.
around, and they need it for housing. They need it to be stable. They need it to do any changes to their situation. Even if we get somebody a subsidy and they move into housing and they don't have anything, it's going to undermine their ability to be stable, right? So it's great that you guys are really focused on documents and income.
Absolutely. One of my clients told me once, money is a mood changer. And isn't that the truth? Right? Okay. So there's more information and a deeper PowerPoint on assessment and planning. It was done for PATH. This is your link to it. There's also a recording on YouTube. So you can use that. It covers a lot of the same information, but much more in depth. So Suzanne mentioned this. We need to really focus on partnerships and linkages. So with housing, what are we going to do, right? We're going to work with a CAN. We're going to work with landlords. We're going to work getting documents. You guys have a lot of that. Some emergency assistance to get the money for a deposit or perhaps a rent subsidy. Financial, you talked about that. Credit repair and financial literacy is something, and there are actually some really good resources in the community for that. Helping people get regular physical and dental care and specialty care, helping people feel better, and helping people connect to resources to feel better and feel some comfort now that will serve them in the future, and they might be able to develop a long-term relationship. So we always want to be thinking about what's the long term and what's going to work in our situation now. Same thing with mental health, right? Help people get a little relief. Knowing the withdrawal management, the detox, right, having all those resources. By the way, there was a crib sheet for resources for substance use that was put together through the PATH program. Molly can do it. It's on the BOSS website. That's been really helpful to people. So you need to know the resources. Mobile Crisis is also available to people, and Molly has reiterated that Mobile Crisis will do a consultation with you. And this is very important. If the Mobile Crisis is not responding, call Molly. She'll help you negotiate that resource, and she's offered that, right, Molly?
Yes, please don't be upset that it's broken. Let me know if it's not working and then we can try and fix it.
Yeah. And there may be other resources in the community. I mean, they may be overburdened right now, but there may be other resources in the community. You want to look at social connection, faith and spirituality, membership. Sometimes it's a gym membership or a ball team. You want to look at domestic violence services. You want to look at VA services and VA services that also provide people with a place to be. You want to look at life skills directed to housing, home care, cooking, shopping, transportation, recreation. You want to look at legal services and make those connections early on, as with, as you guys mentioned, education, both for employment and also GED, trade schools, ESL, those sorts of stuff. College is sometimes something people are really interested in, and that might be a more longer term goal. Okay. So, how do you do it? Right? First, you need to know the full range of resources in your community, and you do that through talking to your colleagues. You can do it on these, case conferencing things. You can do it on these communities of practice. You can do it in your team meetings. You can talk to your colleagues all the time about resources you're looking for. You shouldn't have to reinvent the wheel. There are also we're putting together some of these resource lists that might be helpful to you. By the way, they've all got live links in them so they don't expire. It's also asking the people you serve. It's maybe doing a resource guide. And networking is absolutely key. You want to talk to them. You want to know what they provide. You want to know what their priorities are. You want to know how you can help them reach their goals, right? If the person is like, well, most of the people you refer don't show up. Okay, showing up is a big thing because planning time and stuff like that. How can we help you do that? Maybe we can negotiate it so there's a time where we can bring people in and it doesn't have to be by person. It can be by program, and the person who's ready to come in can come in. I mean, you want to explain your role. You want to explain what you're doing. You want to talk to them about, being in contact. You want to see how it's working. Know somebody that knows somebody. Yes. And you know what? You're going to get that from the team meetings. You're also going to get that from this. Yes. That's really important. And you're also going to maintain that contact with them. And you're going to be that person that knows somebody at that resource. And you're going to be ready to share it, which I have to admit, when I was a case manager, I was not that good at. But I learned. Okay.
Before you go on, I just wondered if I know so we have people who've been around for a while doing outreach, and now you use the CAN process more to come together as a community and share resources, whether people feel like that they have access to more resources as a result of that, if that's made a difference. I'm just curious. Anybody wants to share yes or no, maybe give a thumbs up or say yes or no. Always curious about that. Or sometimes maybe it's the answer. I'm not getting any answers. Okay.
I came in with a Messiah complex and naive. You know what? Yeah. A lot of us think we can do a lot more than we can. And it's a really good point with resources because we need those resources and we can't do everything. And you know what? Our strength is in focusing what we do as case managers. Yep. A lot of us came in thinking we would just, solve this problem.
Fix
How hard could
things.
this be? Huh?
Right, but I think that the CAN now is really because of the planning on a CAN level and really working and outreach on a CAN level is a really great place and location for resource sharing.
Yep.
And also, if you are going to refer to a resource that you haven't used before, maybe somebody else in the CAN knows about it. But I'm hoping that the lack of answers doesn't mean that it's not happening, but more that, of course, it is happening. But just wanted to, I see somebody just put something in the chat.
Looking for local
Um,
resources and information
oh,
about programs around
Molly's
Connecticut.
got lots of
Please join us.
resources as
Yeah.
always. Yeah, great. But I really want to just encourage people to try and think as a community and use your cans to identify gaps in the system. And, maybe you're not going to solve that gap, but maybe, that's important information in terms of future service planning or work with other systems of care, things like that. And I
The other
guess
the other benefit to that is you're probably not the only one looking for that resource. And if the resource
That's
is
right.
not there, you can get together and advocate for it together. And that is sometimes, and help get the CAN involved and get your supervisor involved and get Molly involved, who's more than willing. So here are some resources that people generally need. Is income assistance is big, and you want to screen to see if they're eligible, right? We want to determine eligibility for public benefits, and we want to assist them in applying for benefits. We want to screen for military services and connect people to the VA. We want to ask the question if they ever served in the military as opposed to are they a veteran? We want to connect them with the outreach services in the Connecticut VA who can do a screening and see what they're eligible for. There's a lot of differences in levels of eligibility, and it's important to know because we want to explain that. We want to help people go to appointments, and we want to help them negotiate in appointments. And sometimes it's as simple as getting past the front desk or waiting a period of time to get it. Sometimes it's talking to the person and the resource. All of those things we want to go, we want to observe their strengths in that, and we want to do some mentoring about how to do that. We want to, increase people's income through meaningful goal setting, breaking steps into management pieces, right? Manageable pieces so that people understand how they're doing on this. A lot of people have had not a lot of success in connecting, especially to benefits or been cut off benefits. We want to take that into account, and we want to really highlight their progress or their sense of competency in negotiating with these agencies. And we want to explore work, and it can be informal work. I always thought there should be a jobs program called $50 a week, right? We want to explore all levels, whether it is, a temp job, whether it is a pickup job, whether it is career planning. We want to give people a range of options, right? And really take into account why they're doing this. And it may be role, it may be money, it may be a bunch of different things, but we want to take that into account and offer a range of options. Go a little bit slow, but we want to offer things as quickly as possible. Yep.
I was kind of waiting for the right time to say it. This might be a good time to say it is, the assessment, while we are going to let that unfold over time and go slow with people, hopefully there is maybe some information in HMIS on some people, because I know some people have been around the system for a while. They may have been in and out of shelters. Obviously, that's always an ongoing thing about what you can find out about folks, but really knowing what services and resources people have used in the past. Andrea mentioned this, but I just want to highlight it again. Tells you something about what resources they might use in the future, and finding out if folks have used AA or an NA, if they ever have been in treatment, have they used medications. I think what we find with a lot of folks is that, they have kind of like medication resistant mental illnesses, and they have tried meds, but they haven't worked for them, right? So knowing kind of what in resources people have engaged with in the past helps us, not be kind of at sea about what we might help them connect to in the future, and also want to talk about with people about their experiences. So maybe they did go to PTS treatment for post-traumatic stress, but they really had a bad experience, right? But yet we see that post-traumatic stress behavior, they're screaming at night, there's lots of, they're experiencing a lot of symptoms. Maybe we start to talk with them about a different resource or something, but knowing the past really gives us some guidance for folks in the future, and that, I guess, acknowledging for many people that they've used services that haven't worked for them as we're trying to connect them to new resources, and Andrea's really said that, so that we're accompanying people to make sure they work, so that we can see what that experience is like for people.
Here are some sources of income and benefits. Connect CT is, if you're eligible for medical benefits, help buying food, cash assistance, you can apply for benefits. Those are great. Shannon just put them in the chat. There's also SOAR, which is SSI, SSDI, Outreach Access and Recovery. And there are SOAR workers throughout Connecticut, and I think they're by CAN right now. They've just added some SOAR workers, and Connecticut SOAR works. They also provide training. It's not a bad idea to get your staff trained. I mean, it's been great. They've added more SOAR workers, but they're not going to work with everybody. But to help them put together an application, it might be a useful use of time to take some of the online training, which is no cost, and see which parts you can do and how you can help them do that. And you know what? The access to SSI often motivates people to do things like get ID and tell you their histories and those sorts of things, maybe even see a doctor. So that's a very useful process for people. There are employment resources that there's a link to. There's also supported employment, which is a coached form of employment when they find employment for people and they offer them a coach to manage that employment specifically for people with mental illness. That can be really helpful, and it can be really helpful to people who are, coming into the employment and are a little bit nervous about it, and having that support can be invaluable. So those resources are linked here. Let's go to the next one. So the other thing that often happens is, what about a temporary place to live? In some places, they call them stabilization beds, but it's to give somebody a place out of the weather where they can be safe, where they can regroup, and where you can work with them. And what are your options in Connecticut? Are shelters an option? Are hotels an option? Motels an option? Doubling up with families, where can people go to get some respite from being outside, and also to really focus on accessing housing? So what are the responsibilities and how does it connect with people that they want? So that, let's think about this for a minute. I'm going to ask people to put it in the chat. We're going to do a breakout in a little while, but unless you want to do a breakout in this, what are you doing now to offer people a little respite from being outside? Are there things that you can offer? Are there things that are available through your CAN? Are there things? I mentioned respite. There are also mental health respite beds. Double up with friends and family. That's worked with people. That's great. Especially if it's temporary, sometimes families are more willing to consider it, especially if they have a worker and they're working on a housing plan. And that's something that reinforces the housing plan. Sober living and transitional housing. Yep. That's an option for some people. Has that worked for you all? Do you have access to that? Is that something that people want? Yep. Shelters and warming. Yes. Okay. So that's great, Tiffany. Warming centers. Yes. That'll offer people some respite and oftentimes access to services and, some comfort, right? It also gets people on a plan to housing. That's great. Do people have access to shelters if that's what people want? Is that a popular option? More or less. Okay. More or less access or more or less what people want? Yeah. Gloria House, 7-day mental health peer run respite. That's a great one. Shelters in Connecticut are mostly full. Yeah.
Or people don't want to go in, right?
Yeah.
They have
Yeah.
other plans.
All right. Is that something that you consider as part of your plan? More or less access, in my experience, it really depends on how many beds are available. Yeah.
Pets.
Yeah.
That's prevent shelter access. Yeah.
Yeah.
Well, and I think if people end up going into shelter, which is, obviously a function of whether there are beds available, one of the things about the practice then becomes what's the shelter's role in housing planning versus the outreach worker, and how do you work together to coordinate that so that the ball doesn't get dropped for that person, right? But it is easier to work with someone when they're in a predictable place and you can find them, right? As opposed to maybe having to find them on the street or outside. Unless there's, kind of staying in one particular location. We are going to do a session, Tiffany, on pets, so I'll just shout that out in the end of January. So, but it is a barrier.
In New London, we push pretty hard on the shelter. There is a wait list, but we try to move people in as quickly as you can. And not everyone, but I say to most people, you might progress more quickly in the shelter. There's more staff, there's more services, and so forth.
Which is
Um,
true, right?
yeah. And right now, the warming center is a boon. I mean, that, at least we can offer folks outside something.
Yeah.
And
It's
for
warm.
some, again, they can come to the warming center, get on the shelter wait list, and move forward if that's their wish.
It's great. And it's really important, David, that you explain to them, like, what are the benefits, how they can weigh this, and you have that sort of critical thinking conversation.
Right.
And also explain to them it's a wait list and may take a while, but it might be worth it to them.
Yes.
It's important. Okay. I have a lady with a bird, but they refuse shelter because of her pets. Here we go.
A lot of people will
Pet
not move
pet
into any
adoption,
place
yeah.
where they're not going to give up their pets. So
Mm-mm.
maybe they might agree to fostering, but maybe not. And that is a huge barrier, right? For people is, um, pets. And we'll talk about that in the session. I don't think we have all the answers, but certainly there are some, different strategies around that. But most people do not want to leave their animals, and that's why they're not in the shelter.
And pets are a
And
huge support to
yeah,
people.
that's people's family.
Yeah.
Right. So,
Yeah.
there's a group called My Dog is My Home. We'll be sharing their resources in the pet session and things like that. And certainly encouraged in Connecticut, I know among the shelters to try and figure some arrangements out. I know that it's resources, it's time, it's money, but partnering, frankly, the services for emergency services for animals are more compassionate and kind, I'm finding, than a lot of services for people, like the local Humane Society. But I'm sure many of you know them, your local animal welfare resources.
Kiana
Oh,
said
there's
separating from partners also. Yeah, that's
yes.
not, yeah. So you want to look around for resources where the partners can be together. And oftentimes people use sort of hotels for that, stuff like that. Okay. Yeah, we're going to talk a little bit about housing navigation. You need to know what the choices are available and what the positives and negatives are of each choice and what the expectations are, because we want to explain it, right? Suzanne talked a little bit about Housing First, and one of the primary tenets is choice, and choice comes from education so that people can weigh it out. Choice doesn't mean that people get everything they want, but they understand what the expectations are. And we want to make sure that we understand what the expectations are for rapid rehousing, permanent supportive housing, market rate rentals, low-income tax credit buildings, shared housing, Suzanne talked about that some, and subsidized housing with local housing authorities, what the process is, who's prioritized, who's eligible, those sorts of things, and how long it takes. That's the other thing. And you know what? Sometimes people come in, they just want a Section 8 voucher. Okay, well, they may not be a priority for the local continuum of care, right, vouchers, but they might be able to get on the list, and it may be enough that they're on the list. And even if it takes 3 years, we can talk about what we can do in the interim, so we can have those kinds of conversations. It's not an all or nothing conversation, but we want to explain it. We
I
want
think
them to
we
all.
also have seen, I'm going to just jump in here, Andrea, on,
Sure.
I don't know what the data is in Connecticut, but I know what the data is. I know Sarah Fox and I had a conversation about it the other day about the increasing number of seniors that are finding themselves outside. I think it was a 70-year-old man she was talking to me about on Friday. So also thinking about, it's not on this list, but are there senior housing properties or senior housing programs that person could put their name on the list for? We worked with a group in LA, and it was seriously mentally ill women who had been homeless for a long time, shelter and street, and a woman wanted to live in Malibu. And I'm pretty sure everybody knows what Malibu is, but Malibu's like, one of the most expensive places you could live. It's where a lot of celebrities live in Los Angeles. And ultimately they put her on the list with the Malibu has a housing authority, if you can believe that. And she 2 years later, she got a unit in Malibu in housing authority project, right? So also thinking about what are we going to do now, housing wise, and what's the long-term plan, going again to Andrea's point that we may do something now as the next step. But longer term, many people are going to need a long-term subsidy. And again, we're just reminding that senior services and aging services, because we're serving an older population, have not been historically at the table with us, like the area agencies on aging and those kinds of things, or home care providers. But we do have more people who need those services and starting to make linkages with those resources in the community, especially for folks who are older. That was a very sad story that she told me last week. So
That is a
anyway,
sad story, but that's really
yes.
important, is to understand what different people are eligible for. It may be different. We oftentimes use the VA for that sort of thing, but senior housing is a great example. And what are the preferences and what are the non-negotiables in getting people in? And once again, really focus on the timeline and figure out something in the interim. Okay. We're going to talk a little bit about the housing preference worksheet, which is right there. Suzanne's going to show it to you. And it's a sample framework for helping clients to evaluate their housing options, right? And it also helps them negotiate their housing options. So you see here, it has lots of housing fixtures. And a lot of times people panic when they see this, like, we can't guarantee. No, you can't. But you see how it is? It's, you ask people where they are now. What's their ideal? What's their dream? Let them dream a little bit. Let them talk about what those long-term goals are and what's negotiable and non-negotiable. And what's negotiable for them and non-negotiable. And you're going to save a lot of time. I mean, a housing a housing navigator is going to want to know, I can't live in this neighborhood because I used in this neighborhood. And if I live in this neighborhood, the drug dealers know me. Yeah, well, that's a big problem. And I would say, yeah, that was non-negotiable. It may be other things you want to have a bigger conversation with. I tell this story all the time. We had one guy who only would live on one bus line, and we couldn't figure out why. You know why? Because he only knew that bus line. So we negotiated if we taught him another bus line, and we did, that he could have other options, and he was open to that. But sometimes people get really stuck, right? So you want to figure out what the reasons are. Sometimes people say to you, I only want a house. I only want a house. Okay. Let's talk about what a house means to you. Let's talk about, right? It may be that they don't want to look poor. It may be that they think that only people who have a house have their own bathroom. And then you can explain all of our options have their own bathroom, right? Or you can cook in all the options so that you can have these discussions. So it's really a framework to have these discussions. And then when people find housing, you can talk about, you know what, these are the things that are really important to you that you don't want to negotiate. They have 3 of those, and they have 3 of the things that are less of a priority, but that are important to you. And this other one has 2 of the things that are non-negotiable, but 5 of the things that are important to you. What do you think about that? So it's a framework to have the negotiation. It helps people get unstuck. And it also helps provide guidance for both the housing negotiator and the person, and it gives them a framework to look at their housing options. Do you think this might be helpful to you? Have you seen it before? Yeah? It's worked really well in other places and even in Connecticut. So you may want to take a look at it and see if this can guide some of the conversation with people.
I think it helps laying out for people in one place. This may take multiple conversations about talking about features. There's another box. This is a Word document, so you can do whatever you want to it. It's, again, a recommended tool. It's not required, but helps people dream, which we want, because it's been a while since people done that. Also identifies what's negotiable, but it also, we know where they're compromising. And we're going to talk more about this, the transition to housing, because it isn't all, everything is perfect when they move into housing. Usually they're compromising, they're not getting their first preference of neighborhood because they may not have a landlord reference, or they have the evictions, financial situation. So that we have a sense of what is most important to people. We try to accommodate and help them meet their preferences, but also acknowledging that people are settling. And I think this has come up a lot, is that if we are, as workers, are like, Andrea, you should be so happy. We got you your own place. You can lock the door. You can take a shower. That she has bad feelings about it, and we don't have that conversation. She may never really invest in that unit. she may feel unsafe there, and we don't have that conversation. And if somebody feels unsafe in their housing, they're probably going to leave and make themselves safe, right? So it also gives us an opportunity to have that conversation with people about, yeah, we know it's not perfect, but this is the next place you live. And actually, if you get a year with a landlord, you'll have a landlord reference, and you may have more choices, right, going forward. Or if you do get that job as a CNA, you'll have more income, and then you could afford a better place than what we're in now. So I think that conversation about what the housing is like for people is such an important conversation, because more often than not, there is some little bit of disappointment, right? There's loss involved, and we're going to talk about it later when people move into housing. And there's loss, and then there's also where people compromise, right? But what do they compromise on? Some things are, as Andrea said, negotiable, and some things are not. So I think that was, I'm back to the slides, right?
Yeah,
I
you're
think
back
that
to the
was,
slides. Yeah.
yeah.
So there's a webinar about helping clients to understand housing options, and it's really about the conversation you have with clients about housing options. So there's presentation slides there, and there's a webinar recording, and we encourage you to take a look at that. Okay. So as people transition to housing, Suzanne talked a little bit about this. It's an opportunity for change. It's an opportunity for a new start, but it also involves oftentimes loss. It involves gain and loss, right? So we want to talk about both sides of that coin. It can increase their symptoms because things are different from them and people feel less comfortable. People may, a quiet room will bring on psychiatric symptoms oftentimes because they're more noticeable to the person. It involves a lot of unknowns about how they can do it. It involves self-doubt. Can I do this? I haven't been able to do this before. What makes me think I can do this again? And once again, all those competency work on what you did on competency is going to help with this. And we're going to pass some of that on, which Suzanne's going to talk about. It's going to require a new schedule and helping people do it. And you know what? We want to help people develop a new schedule because we know a lot about how they lived when they were homeless, and a schedule that will make them more comfortable. Otherwise, they'll make up stuff, right? And that it may be going back to the encampment to get the sort of things that they feel like they need, or it may be just doing something else. We had one guy who spent most of his days on Law and Order reruns, right? That was a way to fill his time. That was a way to cope. But you know what? It didn't really move him forward. So we really need to do that work on the scheduling. And remember that this is going to trigger the fears of failure, and that we want to make sure. And yes, validation is important, and validation of the skills and resources that people bring to this is huge. Because you know what? It's people with confidence in themselves that are going to be able to make this transition the best. Okay.
KG, do you want to share something about validation?
No, I just meant like in reference to, having those concerns and just being able to hear those individuals out and letting them know that you do hear them and you do understand why they might not necessarily, be trustworthy of certain situations, or why they may be a little bit more apprehensive, but just trying to kind of give them their own power back, giving them their own confidence and letting them know that they have some say. And, like we've been talking about, basically just kind of meeting them where they at. So to kind of ease some of those anxieties by, just letting them know it's understandable to feel that way, or, things of that nature.
And having somebody listen to you is huge.
Right.
Huge. No, it's very well said. Thank you.
And giving space for people to say their negative thoughts and their positive thoughts both, right? We don't want to just say, oh, everything's going to be wonderful. You're going to move into housing and all your problems will be solved, because we know they won't. Right. And we want to allow people to, talk about those losses. That's when their homelessness episode might come up, about how they lost their job, and then they lost their house, and then they lost their partner, and then they were on the street, or then they were in their car, and then their car broke down, and then they were on the street, right? Like it's a rough story for folks, and being able to be there as they process this change is going to be important, right? Both before and after they move in. Because this is going to come up again. So they might be in the honeymoon period when they're planning for housing, right? And everything's going to be great. Oh, don't worry about it. I'll be good. And it may not be till they move in where they start to feel that anxiety or start to show that. I always think about a building that we opened at CUCS where we used to work, and it was for all people who had lived on the street for a minimum of a year. So long-term street homeless people. And the first year, like I think 10 or 11 people came down to the property manager and gave him their keys back and said, "Oh, you know what? We're going to quit this before we flunk out." Right? It's just safe. We know what to do outside. It's New York City, so we have, there's an elaborate way, not that it's comfortable, but to be unsheltered. And certainly people felt like they knew that and how to manage that. And, the property manager was a wonderful guy. And he said, "Look, you're paid up to the end of the month. I understand how you feel. I got this key right here, you know." And all but one of the people came back, right? And as people saw other people being successful, their confidence built. But it is a scary thing, and it's scary to think about failing again, right? So he was great, and he gave people that room, and giving people the room to talk about that is going to be so important.
So we were going to do a breakout. We're probably going to do it for about 8 minutes, because we want to give time for the last couple of slides, especially
We
the
won't
more
get to
handout.
I don't think we'll get to we'll just start with those slides next time.
All right.
It's
So,
2:45. It's
I
just
see
going
that.
to be a little insane. Yeah.
All right. So, what we wanted, so let's take 10 minutes, and then we want to know what challenges you've seen that clients you serve face when they transition into housing. What are you seeing? And what supports have you seen help people through this transition? So Suzanne's gonna share those to the breakout. We're gonna break people out into sessions. Shannon's gonna put the number in again if you need to call in. Here we go.
I think you could pause recording, Shannon.
Yeah.
I think everybody's back. I think everyone's back, Andrew.
Oh, okay. So welcome back. We're happy to see you. What'd you hear? What'd you talk about? What kind of things are you seeing people struggling with? What kind of supports have been helpful? We know you were talking in there.
I can start.
Oh, great.
So for the group that I was in, we kind of had similar things that we're going through as far as like it being difficult when you're outside for a very long time and then you're housed, trying to get into the mentality that you're not in the same environment that you used to be, and it's kind of hard to adjust to this new lifestyle.
Yeah.
Someone said like still this individual was still sleeping on the floor once they were
Yep.
housed, even though they had a mattress and things like that.
That's
And
fairly common.
yeah, just trying to adjust for sure. And just some of the things that were discussed that is they're trying to take along the people that they're also homeless with. So
Yep.
having individuals in their household that are not, technically supposed to be there and violating some housing standards, and how do we
Yep.
navigate through that? I know that it's a community that they had out there. So like just trying to house the people that they're, very that are also homeless and need some shelter. So that's also difficult to navigate. And some of that is also substance use related.
Sure.
Letting the individuals into your home when they're not supposed to. But I mean, we get it. It's just how do we navigate through all that? So that's very difficult.
Yeah, it can be transactional. It can be, a lot of different things. That's a good list. Tiffany says hoarding, financial literacy, budgeting. Yeah, those are big problems. Socialization, how they socialize. So you covered some of that, and maybe isolation too, as some people isolate and don't leave their house. Yeah. What's helped?
So Claudette has her hand up.
Oh, good. Okay. Great, Claudette.
Hi.
Hi.
I can say that what I found out is that once they've transitioned from being homeless to housed, sometimes where they've been holding in all of that stress,
Yes.
and then all of it kind of is released, it becomes too much.
Yep.
And they kind of have a kind of breakdown in a sense. And that's when they need even more help and support, because
Yep.
now they kind of don't know what to do with themselves. So they need to have some kind of counseling to help them. So they're in this space. This space may not have very much in there, but like everything's just come out at them. Everything that they were going through
Sure.
is now being released. So you're housed and you're happy, but all of that anxiety and stress and everything you've been going through is all being released. So now they have to find a way to deal with that.
Yeah. And helping people deal with that. And you said something really important is stepping up the visits, going to
Yes.
see them more, maybe
Mhm.
getting some resources. Those are really important because it is
Exactly.
the big transition for people,
Mhm.
right?
Yeah.
I
So
also think that the other effect of stress is people can get quite sick.
yes, yes, that also. And
Yeah.
that's when the case managers have to sort of like, step up on the visits and just check in and be there for them and give them more resources, maybe for counseling and or whatever it is they may need, or maybe just talk to them or listen to what they have to say or what they're going through, how they're feeling, so they can get out whatever's in their system. And that's when you go back to sort of like maybe coming up with a mini plan, like one step at a time,
Yep.
to sort of like help them get over whatever it is they need to be getting over.
Yep. And James had said that the new service may be different. I think
Mhm.
that we got to move on because I know this is your time, but I think those are really good points. I think we're going to pick them up next time when we talk about the warm
Yep.
panda
And I
stuff.
just want to, I guess I want to reiterate, because I think this is terrifying for outreach workers, that people get sick when they move inside. So I want to pick up on what
Yes.
Claudette talked about, and that the adrenaline when you're outside, like biologically, a lot's going on too when you're transitioning from outside to inside, and all that adrenaline. And people have noticed people getting sick or sicker, or illnesses emerging and or dying when they move inside. And it can be
Yeah.
really hard on outreach workers, but that's like not your fault. I just wanted
Right.
to do that commercial today. We'll pick up on this subject again, but I think it's an extreme example of how big that really highlights how big of a transition this is for people, especially people who've been homeless for a long time, that it really is a huge transition. So thank you for sharing that with that.
Yes.
I think in the interest of moving on, Andrea, we're going to pick up on these slides next time.
Yeah. So we're going to talk about some of the additional resources. So the first session is recorded and this is the link to it. And the communities of practice are scheduled, and the first one is the 12th. So we'll see you all there.
Which is
We're
this
gonna pick
week.
up, yes, which is this week. And we're going to pick up on some of the themes that we talked about. These are, it's a list of outreach seminars, but the meeting times are going to be different. And naloxone training is also this week. So wanted to make sure that people had that on
Next
the
week.
calendar.
That's next week,
Next
December
week. Sorry.
17th.
I see. Okay. All right. So we just want to say that it is such a pleasure to work with you guys, and we really appreciate all the conversation. And we appreciate the work that you're doing. Outreach is the best.